Good evening, everyone. We're going to start the meeting officially. Folks that are in the audience, if you would like to come up closer, please feel free. If you're comfortable where you are, that's fine. But if you would like to join the table, there's plenty of space. So please feel free. So thanks to everyone for being here today. My name is Michelle Avila, and I'm the chair of the Health and Human Services Committee. This is Bronx Community Board 7's Health and Human Services Committee, and today's date is March 19th, 2024. I will review the committee agenda in 1 minute. I just want to review how we will run this meeting. Bronx Community Board 7 has the right to remove and or ask a member of the public to leave a meeting or ban participation of anyone who engages in inappropriate conduct, including but not limited to obscene or offensive posters or language, personal attacks, threats, or any other behavior that reasonably impedes the orderly administration of the meeting. The board's executive committee and or other assigned committee will review repeated offenses and or behavior and ban the offender for an amount of time determined by the committee. If in-person outbursts or attacks continue, this will be considered disturbing the peace and authorities will be summoned. Everyone besides the speaker will remain silent throughout the meeting. After each presentation is over, the chair will inquire if committee members have questions. Committee members will signify that they have a question by raising their hand when the chair opens the floor. Only those recognized by the chair of the committee will be allowed to speak during the allotted time. We will stay on topic with agenda items. Any other items will be acknowledged by the chair in new business or addressed at the next meeting, provided there is time and the committee agrees on the topic. Following questions, discussion, and public comments, the committee will begin discussion after each presentation or agenda item and will, if applicable, conclude with the decision to vote on a recommendation. When the agenda is finished, the meeting will be adjourned. And so with that, for tonight's meeting, we will review the February minutes. I don't think we have quorum, so we will vote on them during our executive committee, which is later this week. We will talk about 2 follow-up items that came from our last meeting. We will, under new business, we will ask any city agencies or hospitals in our district to provide updates, if applicable. We'll talk about our next agenda and then adjourn. Awesome. And so before I go into asking folks to review the minutes, I'll just take attendance. So Michelle Avila is here. Alfred Grant. Yeah. Thank you. Helene Wilson is absent. Emmanuel Asamoah. Chad Royer is absent. Toby Buford. Is present. Thank you. And Mamadou Sawane is also absent. Awesome. As I said, we do not have quorum, but we are joined by some very special guests tonight. And so we will be recording this meeting and sharing out the recording as we think that the information will be of interest to a lot of our fellow board members and members of the community. Okay. And so if I could ask the committee members that are present to just quickly review the minutes, which should be on the back of the second page, front and back of the second page. And if you see any edits or additions, please just flag so that I can incorporate them before we vote on them during our executive committee meeting. Thank you. This is why we review the minutes. Thank you. Give 1 more minute for folks to give any feedback on the minutes. Are we all set? Okay, perfect. So moving into follow-up from previous month's business. So we had a pretty lively discussion last month, and there were a couple of follow-up items, but one item that is recurring, I would say, throughout the last couple of months is concern around illegal cannabis shops and the desire to know what is being done with enforcement. How do we report these shops as community members? And so our district manager reached out to the sheriff's office, and we are very happy to be joined by the sheriff and members of his office today. And so I'd love to turn it over for an introduction and also an overview on cannabis enforcement efforts for the illegal cannabis shops. Thank you and welcome.
Thanks for the invitation. It's always good to come to the community and speak directly to the people to let them know what's going on. So I'm going to read off some statistics to start the meeting up. Our task force began in November of 2022. It was the mandate of the New York City mayor that the problem would not just be handled by one agency, but it had to have a multi-agency response, and that all agencies would be required to cooperate in handling this problem that the city is facing. Saying that, in November 2022, since we began the task force, we've issued 1,675 total compliance and intelligence inspections. That's how many inspections we've conducted to date. 58,295,000 in civil penalties have been issued, and another $28 million of illicit products have been seized to date. I'll leave this report with you afterwards so you can also share it.
Thank you.
And we broke it down since the beginning of the task force, the numbers from 2023 to year to date. And as of January 2024, we conducted 125 compliance intelligence inspections, 20 arrests, 39 summonses issued. We called 3 sheriff's notices of violations, 192 DCWP notices of violations with 859 violations, 4,218 DCWP counts. So far in 2024, it's $4 million in assessed civil penalties and over 1.6 million of illicit products that have been seized so far just in 2024, January 2024. So that being said, that is the overall statistics for smoke shop enforcement and the task force and the work that we've been doing. Many people didn't know that there was a sheriff's office in New York City, but there has traditionally been a sheriff's office in New York City as the first law enforcement agency in New York. So that's the original law enforcement is the sheriff's office. I hate that we're just simply talking about cannabis, but just to give you an overview, we also we are involved in all civil enforcement. Everything that comes from the courts generally comes to the sheriff's office, from the auctions to the seizing of property, orders of protections, the emergency orders of protections that come with search warrants for weapons. Those are also turned to the sheriff's office. So most of the domestic violence situations also come to the sheriff's office. We have alternatives to incarceration, which is the electronic monitoring program for pre-sentencing that's currently run by the sheriff's office. We do the smoke shop enforcement. We work collaboratively with a host of other agencies. So the fire department, when it started doing some enforcement about the e-batteries, we were also doing some enforcement with them as well. When we go out and do inspections in the task force, we are a collaboration of agencies, New York City Police Department, the Department of Consumer and Worker Protection. Those are the 2 primary agencies. And then we work with any other agency that's needed. So that could be the Department of Health, that can be the Department of Labor, Fire Department, Buildings Department. Depending on the violations that we observe, then we will make follow-up reports and complaints to the different agencies to make sure they come in and take the collective action there. So that's kind of the overall. We get complaints from the communities. The community complaints are very important. So people should always ensure that they continue to make complaints. You make complaints to 311, you can make complaints to the local precinct, you can make complaints to your community board, and you make complaints to your elected officials. All that information comes back to the sheriff's office, where we coordinate the enforcement of the different agencies that are involved. Our police department is focusing on underage purchasing of marijuana or cannabis products toward minors. DCWP focuses on other violations of cigarette and tobacco laws. The sheriff's department does a combination of all that, and we are the agency that seizes all the product from the locations.
That's very helpful. Thank you. Could you talk a little bit about the process? So how many complaints do you need for this to come on your radar? And then, as you said, so we file the complaints either with the precinct or 311, and then what is the channel or the process that then alerts your office this is ready for inspection, seizing?
So I say community boards also coordinate with us by providing us list of intelligence they get from community complaints, and so do all the elected officials at every level. So we focus on locations where they have reported children getting sick or adults getting sick. We focus on locations that are near our schools, our houses of worship, public parks. Those are the first layer of enforcement. And then based on the community complaints, then we'll respond accordingly. There are a lot of these locations located around our schools. So we get complaints from the school boards and the parents associations as well. So we try to coordinate the type of response. We do cover the entire city. And so therefore, we go to all the boroughs, every community, and we do some level of enforcement. And we try to get around and do as much as possible considering the resources that we have. I know you're well aware that the mayor's office has been negotiating with Albany in terms of getting the ability to shut down locations, padlock the locations. I believe that they're making some progress. And you probably should be hearing some great news in the next couple of weeks or months when the governor's budget gets passed. Then I'm sure that they're going to see some changes and some enhancements that will improve the ability for the city to be able to do more direct enforcement. When the Office of Cannabis Management was formed and the authority they gave it to the state agency, and the power and authority lied in the state agency. So they do the best that they can considering their resources and the fact that they have the entire state of New York. The reason why the mayor has been asking for local city enforcement ability because we're much more concentrated what we have here in the city than they have anywhere else, and it requires a different level of response and the coordination of various agencies to be able to handle the situation. When we go out with the Department of Health, the OHMH, they tend to focus on locations where they're cooking with the product. All right, so that's where you get the food and health kind of thing. And then we'll go out with them and they'll do the inspections and we'll assist them in that enforcement.
So when you say cooking, you're talking about doing the brownies? What specifically?
Brownies, pizzas, muffins.
Oh,
There's a host of products that are now hitting the market that they cook with and sell. If they're cooking with the product, then the Department of Health would normally get that complaint first, and then they would notify us if they're going into a smoke shop or a cannabis-related business, and then we would go in and assist them.
How about smoking on the premises?
Inside the locations?
There's smoking on the premises, inside the locations of the smoke shops.
Some
What's the rules and
they
regulations?
should be smoking on that, right? So what you're seeing in the street right now, just so we're clear, is the majority of all these locations are illegal. No matter how they dress it up, you put cameras on it and make it look pretty, they're all illegal. I saw on your poster that you had the sign that should be on the location. If they're licensed by Office of State Cannabis Management, they will have that green sticker and it'll be visible at their location.
This community doesn't have a problem with the legal guys do it the right way. We have the problem with stores who, like you said, and before marijuana was even passed, the cannabis laws, they were able to sell hookers, all kind of smoke products or cigars and cigarettes back in the day, okay? I used to be able to go into a cigar store and sit there and smoke a cigar. These illegal ones can still technically be only selling the paraphernalia, the stuff you use to smoke it in. And that's why they're dressed up the way they are. The thing is that, but behind this, just blowing pot.
The selling of hookahs and other products like that are not against the law at this time.
That's what I meant by it. So that's how they circumstance the law by being a hookah joint, not a hooker joint, a hookah joint. And meanwhile, they're dispensing and selling marijuana and they have it right behind them in the jars. Because you got to remember, when I go in there, they immediately know I'm from the 60s and they want to wheel and deal with me. And I let them believe that.
As long as we get the complaints and the intelligence, we go into any location and do the appropriate inspections that are required, and then we'll take the action that's necessary to close them down.
Then we need to go over how the complaints are done. Because when I get easily frustrated if I can't put a complaint in within 15 seconds. like I do with the NYPD.
In Syria, so
Yeah,
we
go ahead,
have,
babe. Thank
we
you.
have,
Yeah,
QR
I saw that
codes
now. I
so that
wish it
we
was in
can,
Spanish.
yeah, so that we
A
can.
lot of my neighbors need this.
Thank you, Syria, and that's great feedback because our district manager is here and I believe our
Well,
office is the one
it doesn't
creating
say anything
this.
about the stores themselves. It just says stairwells,
We have,
hallways, lobbies, common areas.
this one is for, so the
Let's
bottom
do the
one
bottom.
is
Bottom
for
one's for the stores. I'm
cannabis
sorry, I
shops,
didn't look
right?
down.
And then the top one is for
There it is. Thank you.
enclosed areas. And so,
It's right there.
one second, I wanna make sure that the sheriff gets an opportunity to go through his entire kind of education of all of these efforts and then open it to the committee and members of the public to ask questions. So Sheriff, was there anything else that you
Yeah,
wanted
no,
to
again,
add?
just kind of educating the process.
Yeah.
In the law itself, when you go to court and the judges hear the cases, if they are doing any kind of other business, selling sodas, cakes, hookahs, and things like that, the judges tend not to close them down because the law didn't cover. Law only covered if they were only doing cannabis, then they would close them down. I think the law is going to change now to address that they're doing dual businesses in a location.
That's good. Too.
So the law is going to be adjusted to be able to give the judges who are hearing these cases more authority in that respect. The closing of these locations, again, we issue the notices of violations, which are the civil violations.
Yes.
When we find enough there that it rises to a felony or a violation of crime, then we make the arrest. The first approach is always the civil enforcement to issue the notices of violation. And then, of course, like I said, if we find there's a crime on the location, then we'll make the appropriate arrest and hold them accountable at that level. These summonses are then submitted to the Office of Administrative Trials and Hearings, which they then have to have their hearing. And then a judge will adjudicate the case and determine what the appropriate penalties will be. So they can assess that. We give them a fine for X amount of dollars. They can lessen the fine. They keep the fine the same way. They can lessen the fine. They can dismiss the fine, or they can turn around and issue notice to close the location. At which point, then DCWP or our office will go back and close the locations at that point. But it's as an order from one of the courts. I think what you're going to see is a change in the law, in the new laws, and what they're looking at is exploring how to close them down first after they have one violation,
Right,
and then have them go to court and ask for a reopening of their location.
right.
So I think we're in the process of seeing a reversal in that process going forward, but it hasn't passed yet.
Yeah, that's great to know. So what about for repeated offenders or folks like one location that you've provided various summons for? Does the court then see all of those cases together and then make a judgment on that, or is it doing it on a piecemeal basis, like based on where it is in the process?
No, we coordinate all the enforcement efforts, not only done by our office, by the police department, by DCWP, anybody has authority over the tribes, and we share that information so that when they do a presentation at court, they have a full picture of all the enforcement efforts that were done at the location. And I should tell you, the other part of people ask about, we have issued letters recently to landlords. The district attorneys are issuing letters to the landlords to hold them accountable. We have issued a letter from the city's perspective, warning landlords about their responsibilities. And you're going to see, again, the city council also passed legislation holding landlords accountable, imposing fines. So I think this is the next phase of enforcement, is also holding the landlords accountable for renting these locations illegally.
That's for commercial spaces.
For commercial spaces. And you should say that any of the landlords who were duped, like we found some landlords who didn't know what they were doing. They signed a lease for a grocery store, and they turned out to full-fledged smoke shop in a couple of months, and then they had trouble getting them out. So for people who are experiencing that, landlords, you can contact the local district attorney's office, or you can contact the sheriff's office, and we will provide you with the assistance to begin the process of evicting those tenants.
Thank you, Sheriff. I want to turn to the members of the committee. Do you have any additional questions for the sheriff right now?
What I was going to ask is, we know that the shops need to be legal. And we know that they're supposed to take, and maybe they're not, they're supposed to take place in legal stores. So what happens if there's a situation where someone is doing it in their home?
So the law does not cover currently for private residences. That'd be something that needs to be addressed with the city council. I believe that the city council, local authorities are not going to be given the authority to write their own rules and regulations, how to govern the other aspects of where cannabis may be used in the inappropriate manner. But currently, they're focused on the commercial establishments and not the residential establishments, but those laws and rules and regulations are also coming into place.
Okay.
Is there an age guideline? Because it's that everything that you're saying that it seems like it fits for adults with the constant use of everything, but from being in this community and DeWitt Clinton there, and I work at North Central when I get off at 3 o'clock, I notice the individuals come through the park there and they're right there and they light up. And I don't know the age, but I know they're young. And so I know also is that when they do it, the corners there's like the youth police um, officers are there, but it seems that you can smell the constant aroma there, and it seems like they're getting away with some kind of crime because I think there's an age guideline on children that drink alcohol and liquor.
So it may be a violation, not a crime.
Mhm.
However, the same rules for smoking cigarettes in public also govern smoking marijuana in public. The same exact rules and regulations apply to both. What you have been seeing in these stores and what we see frequently, especially the illegal locations, are they're not catering to the adult population. They are packaging toward our children. This is a serious concern for us, and it's a serious health concern because these are also unregulated products. That means that in the regulated market, they figure 10 to 20 milligrams is what is considered normal and legal. And what these stores are packaging are 50 milligrams, 75 milligrams, 100 milligrams in their products. So we have no indication of, and this is why it creates a serious health hazard, is that we don't know what they're mixing it with, what they could be spraying it. Many people think they're buying a product that is more enhanced, but the reality is in many locations, what we found is that they're spraying the product. And so what people are actually smoking, and that's why we make sure we say it to the adult and the children, what they're actually smoking is not the cannabis, but they're smoking the chemicals that are put onto the cannabis. And this has a more detrimental effect to the brain and other functionalities of the individual. So we caution people to use the legal market. It is a regulated product. It is considered safe. In the unregulated market, you have no idea what you are ingesting and what the impact will be to you. We have found locations, like I said, spraying product. We have found locations dipping product, and they have liquid THC, and then they just put candies into it. And, 10 minutes, 20 minutes, who knows how much THC is actually inside of the candies. And then you're now selling this product. So they're packaging their own products, and they're selling online. You can buy all the different methods of sealing into a seal to make it look like it came from somewhere else. So you have a lot of counterfeit product that is on the shelves. So I would encourage you again, if legal market was designed to decriminalize it was to make sure that we didn't criminalize another population of people who wanted to engage in the business. We also didn't want to open it up to our children. That was not the purpose.
Absolutely.
It was for adult use cannabis. There's a regulated process. There's supposed to be some benefits that come back to the community. In this illegal market, we tell everybody in the community, say, what power do I have? Don't go to those stores, because those stores are selling other products, whether it's soda or cake or milk or whatever it is. If you're going to those stores buying the other products and you know that they're selling illegal things, then you're encouraging them to stay in our communities. So cut them off for any revenue that they can generate and tell them that they can't do this in our community. So we do have some power and some say to be able to have an impact on these businesses.
Or use the 311 number.
Use 311, take cell phone pictures if you want to. I do not confront anybody. We are not telling the community to confront anybody. We know that the community gets upset, they get excited. This is not what we're saying to do. Do not become confrontational. You can take a picture from down the block with the cameras that we have right now. To take a picture, make sure we have an exact address. As much information as you can supply, if you know what time they're opening in the morning or what time they're closing in the evening, or if they don't close at all. This is good information for us to be able to plan our investigations. And I can stress this, because somebody alleges somebody's engaged in illegal activity doesn't mean that they are. We still have to conduct an investigation, and we do the research on the corporations, where we do financial investigations as a second part of this, and we track where the money is going, who's receiving it, where the corporations go back to. So we have ongoing investigations with various district attorneys' offices pursuing those individuals at the next level. What the community sees is the enforcement on the street, because that's the most visible thing. There's no bells and whistles and parades for the investigations that take a long time to occur.
Toby, did you have another
I
question?
wanted to know, are we doing any kind of longitudinal studies to determine if if it's decreasing, if
Right.
if it's more legal than unregulated shops. If I'm making sense, that are we gonna get to a point where we'll be able to know that the illegal shops are decreasing and the legal shops are?
I think we both on both questions. I think that State Office of Cannabis Management is issuing more licenses, so you're going to see that
Okay.
begin to flourish. The legal market will begin to establish itself.
Mhm.
We will always monitor the illegal market and continue to inspect them to ensure they're in compliance. And then as the legal market kind of establishes itself, then I think that once they get their feet on the ground, then the other locations will be more challenged about the business they're doing.
Okay.
I understand that the majority who are in the legal market now were in the illegal market at some time. Seems that the individuals, instead of doing jail time, they're doing legitimate legal business now.
Part of the rollout of the cannabis business to make sure that the community that was previously impacted also had disenfranchised community had first chance at establishing themselves in this industry. So you'll see both participants, people who were previously arrested for this kind of infractions, and then you'll see some new people that were never arrested before also partaking in the market. So I think you're going to find the balance. You have veterans that have also now ventured out to get licenses and are applying for licenses as well. So you're going to have a diverse market of individuals who are going to be selling their product. The caution is just like it says, is to make sure that our kids are aware of the danger, that the adult population is also aware of the health hazards that they're facing when they take these illegal products. And then again, if anybody gets sick, whether they're an adult or a child, if anybody's getting sick, we are not investigating the people who get sick. We just want to make sure we investigate the locations that are selling these illegal products to our community, and we eliminate them from doing further harm. So it's important to report any interaction that you had, any information that you may have received. We know that a lot of parents are getting that information from their children. Again, same thing. If you know your children was able to purchase vapes or anything like that from a location, share that information with us, knowing that they're selling to underage kids. And then that's a different level of investigation that we will also do on those, making sure we shut them down.
Jared has a question.
Yes, I wanted to know, what was your communication with OCM? I do know that they have a list of establishments that they will review in a certain order, and I just wondering if any of those applicants are, if they're operating illegally at this side.
If we, OCM has access to all the information of the people that we are arresting or issuing notices of violations to. And then OCM will have to make their own determination on whether they want to issue the individual a license or not. I believe that the last communication we had with them, that it will have an impact on their ability to get a legal license if they are engaged in illegal activity right now. But I don't know that it eliminates them completely.
Gonna open now for questions from the public. So, sir, did I see a hand back there? Okay, go ahead.
Couple of quick questions, Chairman. How hard is it to get a license to operate a legal store? Because I know I heard on the news today that they're going to start issuing more licenses, but they seem to have been stalled in the process of people getting the licenses, which is why I think we have such a flourish of all these legal shops. And the illegal shops, to Toby's point, I know you have the data, but they seem to be outpacing the legal shops. They are. And they don't seem to be able to get a license. Some of them might genuinely want to get a license, but the process is being more and more difficult. So if they could get more legal licenses, then of course the city is gonna get their tax money. And everybody could make a halfway decent living, then the product could be controlled. So with them being able to spray the product, I'm talking about the illegal places, and spray their product with fentanyl or whatever. I know we talk about it on the news, I hear about it on the news, but I don't think the general public gets enough information telling them what's really going on in connection with all of these drugs that are being contaminated, to use the word.
So I want to start off by saying a few things. One, we are not the State Office of Cannabis Management. They are the ones who control the licensing. We are not involved in that process of who gets a license or their process of how they issue it. They have faced a number of challenges when they first rolled out. A number of lawsuits were filed against them, which held up their ability to expand what they're doing. I also know that they're going to be revamped. They're in the process of being revamped so that they get this information and do it in a more efficient manner. But again, I can't make any excuses for or against them or what the story is with them. I can also tell you this, just so we're clear. If the people that we have been inspecting, that we have found in these new shops, are not our legacy market. And they are not the people from our community. And I say that in twofold. Legacy market is the people who were impacted previously, who were selling illegal markets and trying to join the legal market. That's not this group of people. These people are into making the money in our communities, and they're going to take out every dollar they can before they're shut down. It's our communities that need to pay attention and not support them. The other part of it is that people used to say, well, they are hiring our children. Again, I say no to that information, right? They're not hiring and employing people from the community. And if they were kids from our community, then the question would not be, are they kids from our community? The question would be, if I'm going to sell something in my community, why would I sell it to children and not check their IDs? Why would I sell a contaminated product that I know that will get people sick? So when I'm confronted with this, when I go to community meetings, I often tell them that if they are working and they live in our communities, then we need to own that process and say that if you're walking into a store to work and you find out that they're selling contaminated product or that they're selling to underage kids, even though you work there, you can report it, right? And protect our communities. So again, it hasn't been the legacy market that we're talking about. That's not who we're finding in this process. And the billions of dollars that we're losing in revenue that was supposed to be coming back to our communities to support all the extra programs that we were looking for, we're losing that on a daily basis. So while there's a tremendous effort being made by the mayor in coordinating all the agencies, the real ask is what's going to be coming from the state that allows us to have great authority. And then I believe that the secondary push to this is going to be that they give local legislators the ability to pass additional laws and codes for enforcement. That's going to be given to our elected officials, the city council members, to impose the next level of enforcement. So I encourage the community to reach out to your elected officials and make sure that they're paying attention to this kind of conversation. Because what's going on now was not what was anticipated for the market. It was not the intention of what was developed here. And the people are just taking advantage of it at this point. And when we started, we were let's say, arresting and issuing summonses to people that weren't even living in New York City. They came from all over to establish themselves because they were in other markets outside of New York, but they already had an established business. And then they came rolling their trucks and their product right into the city because it was misrepresented when decriminalization versus legalization. There was a misinformation. When they decriminalized it, it was meant so that the average person with less than 3 ounces would not be arrested. And then they turned that into legalization. It wasn't legalized at that point, and then everybody just began going crazy in the market. So we had to have a learning curve in this respect. I think that it's been spoken about many times that what we are going through has been experienced by all the other states that legalized marijuana. They went through several stages of what we're going through as well. But we're just moving through those stages a little bit faster than everybody else. So we're looking forward to the full, robust authority that the state will be giving us, what the city legislators will be creating for us, and then the coordination with the different city agencies to be able to do the enforcement. I think it will have a tremendous turnaround in our communities to see a difference.
Thank you so much.
That's a good explanation. I love that legacy piece. And I think you should put that on a big old billboard.
Yes.
Say it's not legacy businesses, they don't live in this community, and it's not here to help people.
Yeah, and Jean, I want to say that we did, this committee and later to the larger board, we did have a presentation on the process from the Office of Cannabis Management. You're right. So they initially started by giving like a finite number of opportunities for licenses. So applicants had to apply first through OCM and then make sure that they're contacting their community board. That meant we had 30 or 60 days to review the application and send in our recommendation, not respond or recommend against that location. That gets added to their record, and then OCM is reviewing that along with a lot of other information to decide if they're awarding the license. So that window just closed in December, and as a board, we took action. We have a more simplified version, so I'd be happy to share that with any member of the public or community, because I think, as the sheriff said, this is our effort as well to stop the misinformation and miseducation and really shine the light on what we need to be doing to support our community. So thank you for lifting that up.
We have, and we have,
Share that, because I would like to share that. The tenants here,
Yeah.
because the more we put that information in, what the gentleman just said.
Yeah.
Got to educate our own children, our own residents, the people in the communities, because a lot of them are under misapprehension that these people that have these shops, oh, you live in the neighborhood. So you're here to help the neighborhood grow, and it's all about that.
yeah, and again, we encourage when the community boards are now reviewing these applications to ask them the additional questions of, is anybody on your board still involved or been involved recently in violating the law, right? So these are questions you can ask. Have you worked in a shop recently that has been closed down or issued notices of violations by the sheriff's office, not only in your district, but outside of your district, right? Because they come to a particular community board and they're very nice, but they could have been in 15 other community boards doing everything bad. So it's important to ask the questions. Have you been in violation anywhere else? Has anybody, a part of your corporation, been recently issued summonses or arrested for violating the rules and regulations of the Office of Cannabis Management? And another thing I say to you, these stores that you're seeing, if they were trying to comply with the law, so it's not people that are waiting in line and say, oh, I couldn't get a license now, so I just went out there. If that was the case, then they would have complied with all the rules and regulations that the State Office of Cannabis Management imposed, which you can't have packaging to children. You can't have the lights and you can't have the signs. None of that stuff is legal. When you look at a legal cannabis shop, you see it's more reserved. All right, so there are actual rules and regulations that need to be followed. So you had a better chance if you told me I was waiting to get my license and couldn't get it, so I went illegally, but I'm complying with all the rules and regulations. Then you might have a better voice. But none of these locations that we're encountering are complying with any of the rules and regulations that have been established by the state. So that's why I said it's a totally different market. People who are bent on violating the law and trying to make as much money as they can for as long as they can before they get shut down.
Toby, I think you had a suggestion, and then Sirio.
I had a suggestion, Jean brought it up too. Is there any pamphlet or anything that we can give out to the public at large, maybe to parents, so that they will know what to look for and what not to look for in terms of the shops that their children are going into? Is there anything that we can put together that we can hand out at outreach and fairs and things like that to make people aware?
The Sheeta Dawson is in charge of the New York City Office of Cannabis Management, New York City, NYC Cannabis. NYC Cannabis has a local office. They have local resources. It falls under the Small Business Administration.
Cannabis, okay.
NYC Cannabis, and you can ask them for resources, pamphlets. They do community events. We've done community events with them by educating the public about what the legal market is supposed to be like and what the dangers are of the illegal market. So we've gone out with NYC Cannabis as well as the New York City Police Department doing these community events.
Yeah, location. Now, you know, this is popping up all over the place, but say, for instance, in this neighborhood we live in, it seems that a lot of these places, I got to make sure I see this to see if it's legal or not. But a lot of things in this area, like we have mental health programs up the block. We have a homeless shelter up the block. We have schools here. We have mental health and methadone programs here. But it seems that one of the locations where individual has property, and I believe in the area where the homeless shelter is, and the methadone program, that he has supposedly a legal shop. I think it's up the block.
It would be illegal. There's none that we know of that are legal in our community board, right, Carla?
So they're all
No. So it's
anyone.
But in terms of the location, they're not allowed, whether it's in this neighborhood or not, compared to these areas, schooling,
They're not allowed
methadone
to.
programs.
That's what I'm saying.
Is
If
it-
they were compliant with the
We need to
law,
get that out there.
then they would not be in these locations. Because the law prohibits that,
Mhm.
right? The state office regulations prohibits everything you're seeing. That's why you see a stark difference between the illegal market versus the people that are in the legal market. Any location, you can go to NYC Cannabis, or you can go to the Office of State Cannabis Management website, put in the address, and they will tell you whether it's a legal shop or illegal shop. And you can report anybody online as well at both of those locations.
We'll see that on Google.
Yeah,
Oh,
yeah, you can report them. So if you're checking an address or you find some
address.
information,
Mhm.
you can put it in, make a complaint online to the State Office of Cannabis Management and NYC Cannabis. So both of them will take, but you can verify addresses. Like if you say, I'm not sure, I didn't see the sign, I didn't see the green sign that's supposed to be to say this is a legal shop. You can punch in the address and they will tell you. And then as you're reporting it, they'll tell you whether it's legal or not, and they'll record whether it's illegal so they can go back and do enforcement.
Sheriff, we have a question from
Well, I got
Syria.
a few questions.
Okay, what?
The first thing is directed to the officer. Being that your colleagues are not here from the OCM and NY Cannabis, I will refrain from asking you any questions that only they can answer. But I may throw them at the community board. My question is, the year that they they wrote it in legislation saying that the sheriff's department will begin to enforce the smoke shops. What year was that, you said?
2022.
2022?
November of 2022, the mayor announced
Not the mayor, I'm talking about the governor. You're a state agency or a government?
no, we're a city agency.
Your city, the sheriff's a city agent.
Sheriff, City of New York.
Okay, good, the mayor, okay.
The mayor announced in November, a task force to address the proliferation of illegal smoke shops.
2022.
November
Okay.
2022.
Now, you being the head sheriff, you said you're the lead sheriff. How many officers did he add to the task force to strictly deal with cannabis stores? Because that was a brand new thing. How many officers, sheriff's department officers are strictly on the payroll to deal with cannabis stores?
There's been no new resources taught. There's a collaboration. There's a collaboration between the different agencies using all their resources to operate.
Now, the mayor knew this. He put it in your lap, knowing that you had, how many officers you have under your belt?
We have approximately 150.
550?
150.
150
Throughout the
officers.
Bronx or this?
No, throughout the whole city of New York. 5 goes in, that's 30 cops per borough. Right?
You're calculating
3
wrong.
shifts.
You're calculating wrong because what I said is this, the following. We are leveraging the resources of 5 or 6 different agencies. So it's no longer just the sheriff's office of enforcement, it's leveraging what each agency has that they can pull together for the operation. So it is a collaboration of different resources, not a sole source agency response. And that's why the numbers, when you try to add them up that way, don't quite work
Okay.
out.
You know, and I know that without an officer in a blue uniform with a gun on his hip and a badge on his chest, them guys, we had people come here about the car washes, and what did that woman say? That they get beat up by the guys selling the things. They're scared of them, and they don't have officers in the law. So it's the same thing with these stores.
Not this
Without
meeting.
law enforcement personnel, a uniformed officer, with or without a weapon, these people walk all over. I understand what you're trying to tell me, but I'm telling you, going back again, it's only 5 goes into 15, 30 guys per borough.
Again,
3 shifts.
you're only focusing on our agency. And I said,
That's all I'm interested in. You're the enforcement officer.
listen to me, and the calculation is wrong. It's a collaboration of agencies. When we work, we're not working with just the sheriff's office. We're working with the police department, we're working with DCWP, we work with the buildings department, fire department, Department of Health.
How many law enforcement officers have, like, I know sanitation has guys with carrying guns.
Mhm.
So how many of those agencies got licensed enforcement agencies, peace officers?
DCWP, the New York City Police Department, and ourselves.
Okay. Very good. Okay, my second question is, okay,
The
I
peace
think you
officer.
kind of answered about when they shut
Yeah.
it down.
The investigators are, right? I thought they were, okay.
When you close a place, within a week or two is reopened.
Yes, sir,
That's because of legislation, has nothing to do with your office.
that's correct.
Thank you. All right, corrected that. How far from schools are they supposed to be?
500 feet is supposed to be.
500 feet, all right, and that's legislated by the state,
The State Office of Cannabis Management.
state office.
Syria,
500 feet.
I did want to add, so when we were considering a couple of applicants that came through our community board, there was depending on where you measure it, so if it's from entrance to entrance, they could meet that requirement. But we had a situation where there was one, the entrance and then the proximity to the school campus was less than 500 feet. So there is some gray area there. Just want to flag that for you.
Okay.
It's very great because say for instance, from DeWitt Clinton Park, the
That ain't
leads
500
there
feet.
is more than 500.
Yeah, it was
feet.
more than
That's
that.
where on Jerome Avenue, the shops are.
Right.
And that's a business strip, where it makes it very easy
Technicalities,
for
I
them to
think
open
they
the
might have to,
stores.
and one of the things that I do believe that this is a type of thing that there's room for growth for
Yes,
enforcement.
and that.
Because these are the type of things that you have to look at trial and error.
Yeah.
And because I believe that the summertime coming will show a big picture of the way things should be enforced.
I'm glad you said it, because again, this is a developing industry and people have read the law and try to figure out, people with bad intentions try to figure out every angle they can. And that means that law has to be flexible enough to adjust to the criminal mind or the people that are trying to beat the process, right? So this will always be something that will be in progress. And again, we encourage the legislators as well. We're making the rules. We enforce the laws. We don't make the laws, right? So when we're encouraging them to have enough flexibility to be able to address those situations like that you're talking about and the impact that it has on our communities. And we had very good conversations with our elected officials who are very concerned about the complaints, not just here in this community, but in every community that's facing this challenge right now. So I think there's a collaboration and a collective conversation that can be had to be able to improve the enforcement, to do both, to make sure that the legal market gets its opportunity to grow and do what it's supposed to do and bring back the benefits to our communities. And at the same time, be able to do the enforcement that's necessary to close these locations down so they don't negatively impact our communities. And I think that's the goal on both ends. So now if we're doing one or the other, it's kind of doing both at the same time.
My one question I wanted to finish up with
Yep.
is, how many applications the board has now on the books before?
We don't have any before us. So again,
Positively
that,
none.
no,
Thank
so that window closed. So
Really?
OCM for the first round, they're
Oh.
going to be releasing, okay, we're gonna do 100 more applications, consider 100 more applications and licenses, and then that'll be for the entire New York City and state. And so then folks will come back in. And I'm just saying 100 as a number. That's not a definite number that I've heard or that we've been notified about
Throughout the city.
Throughout the state.
throughout the
Throughout the
state.
state.
Yeah, okay,
Throughout the
that's-
state.
that sounds nice.
So thank you, Serial. I want to be respectful of the sheriff and his team's time. So we'll take, is one more question okay?
Sure.
Okay.
I want to also make sure, introduce our team so they know who to reach out to.
Any big shops within the CB7 area?
No,
You
No.
have none.
no.
Only the medical.
Only the medical one on Fordham
facility,
Road.
Very life.
Very
on
life on
Fordham.
Fordham
On
Road.
Fordham Road.
So the medical marijuana locations have been around a little bit longer.
Yeah.
They have been established and they follow the rules and regulations again.
Yes.
But this is also a different type of community that we're talking about what's going on right now. So I think everybody realizes the seriousness of the problem.
Mhm.
And with using all the resources available and the parameters of the law right now to make sure that we're complying with the law and taking the appropriate enforcement action. But I think we can look positively on the fact that they've had several good meetings with the governor. We're expecting good things from the governor's office. And we're expecting that our local legislators at some point are going to have their hands in this, and they're going to be able to put the next level of enforcement or regulations in place to ensure that the legal market flourishes, but at the same time, the illegal market begins to diminish, and we get to eliminate those from our communities.
I just want to, one more thing is just something that just crossed my mind is that I hope that in the expansion of this whole system, that what is not allowed is mobile units that can move from one area to the other. And that is look like that is something to be dreadful of, because if they have a license to do it legal in a mobile unit, then like a lot of the yellow cabs used to do is split their license or whatever, and next, it
So-
will be more hazardous.
From what I know of OCM, they're not allowed to split their licenses between locations. It's one license per location. So each location needs to have its own license. I do not believe that anything mobile has been authorized at this time. I don't know what they will approve in the future. I know that we have been seizing these vehicles and removing them in the street with the police department on a regular basis. So they pop up, we take them, we issue them summonses and fines. And some of the settlements, we had the vehicles towed outside the boundaries of New York City. So the New York City Law Department was able to negotiate that in some cases where they wouldn't even allow them to drive the vehicles off their property. They would have to be towed, and they had to be confirmation that they've been towed outside the New York City boundaries. So there has been effective responses to this. But again, they're going to be creative. We need to be as creative in our response and ensure that we're holding them accountable. And every way that they create, we got to be responsive in that respect. But the community plays a big role in that, because you'll see it first. Our kids and our families will see it first. And it's important to share the information as much as possible without, again, stressing, without putting anybody in direct danger or confrontation with anybody who's involved in illegal activity. You can observe, you can report, and allow the proper authority to take the appropriate action. As frustrating as it may be, we do not encourage you to confront anyone, either in the shop or on the street in this regards, because you never know what confrontation you're going to end up in. Better to report it to the authorities, the people that have the ability to do the proper enforcement and take the appropriate action. And again, I want to thank you so much for inviting us here.
Thank you. This is
Thank you for coming.
very informative.
And most of the time, you'll be speaking with our public relations team, Sergeant Rosa and Sergeant Robles.
Hi.
They're here with you. They get most of the complaints and the lists from the community boards and the elected officials and community people who are complaining. And then we coordinate the enforcement or share the information with all the other agencies that are doing enforcement right now.
Thank you. Thank you so much, Sheriff. We really appreciate it. Thank you to your entire team. This was great work. Thank you. Thank you.
Thank you, sir, really.
No problem.
I appreciate it.
So y'all did see last time, huh?
Yeah, you know me. I make my round. I have what's involved. So
Oh, yep.
you gotta keep an eye on that one down in there. Too far away from me.
Thank you.
I got three on my.
Excuse me, sir.
Again,
I'm from the Union of DC.
DC 37?
I'm up here at North Central, the chapter chair.
But reach out. Okay, if they want us to talk to them about any of the things that we're seeing and the impact it has on your members, or reach out to us, and we'll go through that presentation as well. Okay,
Thank you, Sheriff.
again, thank you so much.
Thank you. It's
You have
very
your work.
informative.
Thank you. Here's the stat so that you can.
Yes.
Review some share.
Thank you.
So much. So is there anyone here from the Department of Health and Mental Hygiene? Anyone from Montefiore? We do have Diane Arroyo from North Central. Hi, Diane. Thank you for being with us tonight. And we appreciate North Central's constant presence and support and work in the community. Is there anything you'd like to share on your end?
So of course, I see that you do have the flyer, Stop the Bleeds. We did have a meeting, we did have a training today. So the next one, and it'll go down in the month of April. April 2nd, April 16th, and April 23rd. It's the Stop the Bleed training. This training is actually very useful for not only folks in the community, but outside of this community as well, because this gives folks a fighting chance. I myself have taken this training and it is intense. It is something to really stay focused on because of the fact that there's so much going on in this community, in this world. Another items that I do have, of course, we do have a digital magazine. And if you go into our North Central Bronx campus, of course, you'll always see all of our flyers on the wall. There is a QR code. You can scan it and it will send you directly into the digital magazine that we post every month. So this month, of course, this is going into February. So now we're going into March, and the March calendar, March digital magazine will be coming out shortly. Of course, with myself, so I am the Assistant Director of Public Affairs and Community Relations. So I cover not only North Central Bronx, but I also do cover Jacoby as well. Of course, with Jacoby and North Central Bronx, we are two hospitals, but one campus. So we do have an autism awareness acceptance resource fair that's happening at the YMCA in the Northeast Bronx. We do have a lot of community workshops. So if anyone is interested in having us come to you to perform these presentations or workshops, feel free to reach out to myself or the Jacoby NCB Public Affairs email address. So this Jacoby NCB Public Affairs at nychhc.org. I do have my business card. It is digital. So if anyone needs that, of course, feel free to let me know. We do have a grandparent safety week that's coming up in the month of April. That date is April 26th. So that is more of a safe date because we're still finalizing everything for that event. That event will happen at Jacoby campus. So we are looking at senior centers to come over to Jacoby. And what I am working on doing is if those have like transportation, if they need parking, of course, I will reach out to hospital police to see how we can make sure that there is parking for the vehicles that are coming for this presentation. We do have a lung cancer walk that we do every year. Of course, that's going to happen on Saturday, May 18th. There's a QR code for you to register. And of course, the walk starts at 9:30 a.m. We do have tabling that's happening here at NCB. So of course, for this month, we do have our special care, where our special care will be downstairs in the lobby right next to Tasty Picks. They will be providing all the resources and of course the services that they provide for our patients or folks in the community as well. We do have every Wednesday, so starting even tomorrow, the ID NYC renewal appointments, they are downstairs in our lobby at next to Tasty Picks, and they're there from 10 a.m. to about 3 to 4 o'clock p.m. So anyone that is interested in getting a ID, of course, they'll be able to help them get the IDs. If they need to renew it, they'll also assist with that as well.
Diane, you have a question?
Do they need an appointment or is it walk-in?
You can actually walk in, and then what happens is they'll give you all the required steps to assist with that.
Serial, did you have a question?
This is at NCB, yes, and it's also
A
at
digital
Jacoby.
ID New York.
Diane,
right?
you said you have a digital business card, right?
Yes, yes.
Talking to a dinosaur.
So once you go into your camera, you'll see the QR code, and then you'll just scan it.
Download that code.
Huh?
You have to download that code, correct?
No.
Yeah.
I have the QR code. You
See,
just
I-
scan it. I'll help you.
Me, I'm a dinosaur.
Of course, we do offer free tax prep. So we do have a flyer for that for folks that need assistance in filing their taxes. Every Friday, we do have a section where we are always hiring. So whether it's for nursing or non-clinical, we do hire folks on the spot every Friday. There is another QR code that goes along with it. So once you scan it, of course, you'll just submit your resume to Human Resources. Human Resources will be able to review your resume and then, of course, make the necessary corrections in hiring you and starting that process.
That includes security or personnel
It does include that, as I believe.
on Friday?
On Fridays, yes. They have hospital police. They do have those trainings that
My
happen
sons have,
there.
they're certified to be security. I'm not trying to take over the meeting, but they're certified to be a security guard. They got the certifications and the training in CPR.
Yes. So I believe once they scan it and then they put their resume through
They be
HR
telling me they're going out looking for jobs. If you want, they never went to your building.
every
I
Friday,
know.
come every Friday.
The more you know.
They're gonna be surprised tonight. When they go.
Is anything happening with the sexual assault treatment program?
At which location?
NCB, because I know
That one I'm not too sure of
Okay.
as of yet, but once I get that information,
Okay.
I'll share that with you.
Thank you.
You said what was the
The sexual
Sexual
assault,
assault.
it's SART, the sexual assault. Response, SART, sexual assault treatment program. Carmen Calderon is a part of it.
Okay. And like I said, I'll
Okay.
reach out to them and find that out, and then of
Getting
course I'll
warm, so I
share.
know when it gets warm, those type of crime increase.
Mhm.
Diane, you also have a question.
Yes. You have a mental health component too, because I saw in your last meeting, you had a whole big thing on mental health. And that seems to be a big hot topic today, because every time I turn on the news or walk up the block, somebody having mental health issues, a lot of fresh young people. And I know you guys did a whole forum on it, so continue on doing that because it seems to be really getting out of control.
Yes. So we do have, of course, for our behavioral health department, even at NCB, we did actually open up a few more beds. I believe it's in 12A for those that are having mental issues at that current moment. I host a lot of various workshops, and we also tag in the behavioral health department to help with that and assist with that. So if you need us to come and do like a presentation, please feel free to reach out to myself, because we are ready and willing to provide those
Yeah,
presentations.
the answer is yes.
Yes, yes, and yes.
All right, so I'll give you my card after this meeting.
Diane, did you have others? I think Sirio has a question.
Yes.
Okay, the worst part of North Central Bronx is the division given to Rikers Island. What's the story with that?
The division to Rikers Island. Are you talking about Jacoby's?
No, the one up there in North Bronx Central. The 3 floors that were turned over to the what's not the police, the other ones, corrections officers.
That one I don't.
The thing is this, because since I represent the Behavior Health Associates there and I represent the majority of people in North Central.
Mhm.
That's
If I can't hear you.
that thing with Rikers Island is put on hold, deep hold. Because it seemed that the mayor with immigration, everything was stopped and halted. So they have changed the
I didn't
15th
know that.
floor. The 15th floor, which was supposed to be part of
Right.
Correct.
Rikers Island, is now going to be the lunchroom. I think it's going to be a lunchroom for people to go up there.
Mhm.
And so there is everything pertaining to Rikers Island seems to be on hold for a while, I believe.
It's including Act 1920 Seminole Place that's on the campus of Jacoby. Because as far as I
That's
know,
your
that's
Jacoby.
supposed to be
No, we
moving
only talk about-
forward.
Just home is
No,
different.
Okay.
Jacoby
Okay,
is an entirely different
Okay.
thing because
Yes.
I
I
think
know
that's
that's
what
not-
they call building 4 or building 8, the one that's
Yeah, it's
abandoned.
a
That's
whole
an
building on
entirely
its own.
different
Okay.
thing.
okay. I
That
don't wanna
probably
make it
will
about
grow
them.
more so. But their community board, I believe, is against it.
It's
Yeah.
fine.
Very much so.
Mhm.
Unfortunately, we.
Mhm. But it's time they got their fair share.
But we also have a security program going on. Now it seems that with the weapons detection units that we have now,
Mhm.
because I was noticing they're putting the doors up and they're
Mhm,
stealing it.
mhm.
Can't walk in.
So it looks like
A prison.
it may be a bit of confinement, but it's a safety net.
It really is. To be honest, so not only am I the Assistant Director of Public Affairs and Community Relations, I'm also the CAB liaison. So, in reaching out with the CAB liaison and explaining to us how safety is very important, you find various, events that's happening inside the hospital. Jacoby was one that was hit with that same similar situation. You have Bronx Care. At one point in time, it was called Bronx Lebanon. They had that similar situation. So whenever I see something like this, of course, we always think of the negative, but we need to really ensure the positive in that, which is safety. So in looking at when we first initially started, the amount of weapons that we had to take, and majority of the weapons were steak knives. That's in folks' pocketbooks. Any other type of serious, and I've even seen it where a doctor comes in and they have a scalpel and they had to confiscate that. And she's like, how am I supposed to work? But it's really about safety and how to make sure that, not only are the staff safe, but our patients as well that come inside that building.
Thank you. Thank you. Diane, did you have other updates?
That is all that I have, but I will be able to share all these flyers with you via email, so that way you have it and you can also continue to share it with the community as well.
Thank you. Any other questions for Diane? Thank you. And I know, and thank you for hanging out with us. I want to be mindful of everyone's time, but we do appreciate you being here and being so thorough with your report. So thank you. And thank
Not a
you,
problem.
Alfred, also for
Yes.
filling in on the pieces as well. We're lucky to have you on.
I always stay in contact with Alfred Jones.
And then another thing is we do have our CAB, Community Advisory Board. We are still looking for potential members. So if you are interested, please feel free to reach out to us. What is required is just to have your presence, be able to have that voice, be able to you really give not only the hospital visibility, but to understand what's going on inside the hospital. So that way you're able to give that visibility and within the hospitals as well, and in the community.
What's the time commitment?
So with the CAB for NCB, it's every first Wednesday of the month. The meetings are usually at 5:30 and ends at 6:30. Every first Wednesday of the month. And then, of course, we do have CAB committees. So we have a legislative committee, a membership committee, strategic planning, patient care. Those committee meetings, they vary. So depending on which committee you are a part of, then of course that'll be another once a month type of meeting as well.
Do you run that all year long, or do you break in the summer?
So we do break in the summer. So it starts in September and then ends in June. And then from August on, it's like a break for everyone. And then we come right back in September.
No, we do the same thing.
What is that called again?
It's
So-
the Community Advisory Board.
They brought that back?
Yes.
So just a little information about the sexual assault treatment program.
And Diane, is there a way that someone can sign up to receive the newsletter?
Yes, most
Okay, so
definitely.
Okay.
In case you're not. Okay,
Okay.
because I believe April is sexual or domestic violence, sexual assault awareness month.
Mhm.
Okay.
When you're ready for that.
Okay. All right, folks. Diane, anything else?
That is all. I
Oh.
promise.
No, this was very helpful. Okay, so moving along, I don't see anyone from Department for the Aging or the Mayor's Office of Immigrant Affairs. Our next meeting is on April 16th, so please keep an eye out for notices.
May I put an agenda item? on the meeting?
Yes.
So what I would like for us to, on March 1st, a person lost their life. That in a house on Grand Avenue that was illegally converted from a 1-family to a 3-family home. And I would like for, I mean, as far as I know, based on the information I've read, people still not have, and maybe you know more, have not identified who this person is that passed away due to the fire. The person was up in an attic portion of the house and basically was trapped. So
Where's that? I'm sorry, Toby, I couldn't.
On 190, between 190th and West 192nd Street. On March 1st, a man lost his life in a house that was illegally converted from one family home to a three-family home. The person took that home and made 17 different rooms. So to me, I feel like this is something that's hiding in every community, probably in every borough of the city, and we don't know about it. So I was wondering if maybe we can bring the Department of Buildings in so we can get some type of
That's on the house.
some type of information about it, what's being done about it. Why was this able to be done? Because most of the times you have to submit documentation and permits and people to come on site to make sure you're doing it well. I find it unfathomable that someone could have done this. And the issue for me is this wasn't done because you needed the money. This was done for a different reason, because to convert a one-family home into a three-family home so you can make 17 different rooms put everyone at risk.
So 1 second, I saw
Mhm.
Serio and Alfred, but I want to say, Toby, that we can bring this up on the executive committee.
Okay,
Because
all right.
I think Serio is gonna say, or I heard him say that, this is also, DOB falls under housing.
Mhm.
And so at Thursday's meeting, we're gonna have all of the committee chairs there. We can talk about this. Carla and the office can try to get more information from the city agencies, and then we can talk about, is there a webinar or a Zoom that we could put on to talk about illegal conversions? Is this a larger
How do we
problem?
stop it? Mhm.
Right. So
It's a
that's,
silent problem.
it's a
That's the
silent,
issue.
go ahead.
To piggyback on her complaint, I know of an apartment at 2805 University, 4H, I'm in 4H, 4I. It's a single bedroom apartment. There has to be over 5 adults in there, 2 children, and 2 bicycles, electric batteries going in that apartment. And that's under the Morgan Group. All right, the reason why I know all this, because my wife don't like people knocking on the door and not knowing who it is. She put Bing, thank God for Bing, and the other one, Ring and Ding, or whatever they are. He's got the camera on his door, and the minute somebody goes by that camera, she checking it in her house. You don't have to do this.
And I know that the marshal's office is investigating it, but at what point now does the NYPD get involved? Because clearly that person died because the home was illegally converted. So now someone's responsible for his death.
Be the fire department.
Yeah. And go ahead, Alfred.
I really don't think that's something that the police department handles, because if we open up our eyes, we see that that's fluent throughout, especially this neighborhood. There are many people in the cultural thing between this immigration thing that happened, that what do you think these people are coming in? Because you could be in that place called Tracy Towers, and you might see maybe next door a one-bedroom apartment where your dog keeps barking at night. Believe me, this is affluent. This is all over here. And if you don't know that, you got to open your ears and look at your eyes, because you can see it's all through.
Go ahead, Toby.
My point is, it's still silent because you took a one-family home, converted it into a three-family home, and one person died, and 17 people, more than 17 people were displaced because of this. So this is not something that I think we should not ignore anymore. I think this is something that we need to address, because I agree with you, it's happening. It is happening, but someone lost their life,
Yeah.
right? And someone lost their life because and I'm gonna put it out there, because of greed, because you did 17 different spaces. You didn't do 5. You didn't use the structure of the home to provide comfort for people who may be undocumented or family members down on their luck. You took this home and made 17 different rooms so that you can take their um get money from them. And to me, that's a crime. And to me, that is something that that person needs to be held responsible for, because
Yes,
you
so-
actually caused someone's death.
The same thing with a guy who took a furniture store. I was in the news. He converted it to a living quarters
Yeah,
with no bedroom or kitchen, and they were living in there.
yeah.
And then everybody found out.
So-
There-
And our role-
Had in the Bronx, he had in
Not gonna let
Queens.
it
The
go.
Queens
And
was the
no,
place.
no, I hear you all.
Like,
And
our tears.
our role as a community board is to liaise with our city agencies, our elected officials. So there are ways that we can take action and say, as a community board, we do not think this is acceptable. And so I offer that as a potential. I offer us trying to get more information on this as a potential avenue. And then also let's educate ourselves on how to report illegal conversions. It might be that we do 311. It might be that we have to partner with public safety and get the precinct involved and understand what are the options to make sure that we're not criminalizing people that are, maybe they're the folks that are living in there, maybe that's all they can afford. There's also a deep affordability problem in New York City that we're all very familiar with. So I think that we can definitely put this on the agenda for future discussion and for future action.
Thank you.
On
You
the,
also have to take into consideration that even though they have those multiple homes, because I can personally say this, because my mother lived next door to one, and they had a 3-alarm fire. And it was so hard for them to like get in there because of the fact that it was multiple homes. But with these, the way some landlords do it,
convert that,
is-
yeah.
they have daytime families and they have nighttime families. So you also have to take that into
So now
consideration.
17 becomes what? 35?
No, there is a lot.
34?
So the way that they were able to spot what Syria mentioned was people keeping an eye of things, right? They started seeing that there were a lot of people coming in and going out of this specific location, and they were like, what is happening there? And someone filed that 311 complaint, because that's what it takes, right? That's what it takes for you to take action,
Mhm.
to have an observant eye and say, like, there's a little bit too many people living there.
Is that something that the sheriff would look into instead of the New York City Police?
That's a good, he said civil,
Mhm.
so I'm,
How civil?
yeah, no, I'm wondering. We
No,
can
so-
find out.
yeah, we'll find
We
out,
can
yes.
find out. Okay. Our last agenda item, so Toby at our last meeting brought up the important piece around naloxone trainings, and we had a gentleman come before the committee and the board with an organization that he co-founded, I believe, and offering free trainings. So we want to make that available to the community board. They offer to come to tonight's meeting, but it's an hour training. So we talked about having it on Zoom so that it's more accessible and folks can watch it. And then if folks want an actual kit, we can distribute them from the office.
The training will be given by Department of Health.
Oh.
The hygiene.
Oh, wow, okay,
Mhm.
so by the Department of Health and Mental Hygiene, and we can also give the kits
Mhm.
out, so we will be in touch about dates.
Okay.
Yeah, but thank you for flagging
Yeah.
that as well, Toby. Yes, Sirio?
Yeah, going back to VE, Mayor's Office, Immigration Affairs.
Yes.
For those who don't know, but I know for being on the constant patrol along Webster Avenue, all those hotel motels, whatever they built back in the day, they all been converted to homeless shelters for the migrants. So all 3 or 4 of them are currently being run, and there are state troopers there monitoring the people, the personnel. Because that's how I caught my eye, because in the motel or hotel, with no parking, was a hotel. I'm sorry, had no parking.
Hmm.
All these guys in green were in there, and I was very intrigued by that. So of course I had to wander in there and find out what was going on. And then I wandered down the block, and then there was a new building they built, and that's controlled by the city Department of Health and Hygiene
Yeah.
for the once again, the homeless.
Concerns?
And then another motel, which is privately owned, got a contract with the city to house homeless families with children. So luckily, we're dealing with families and children, not the single men. So these people are very responsible because they have kids and wives. Just to let you know, but I was wondering, because I was at the clergy meeting with them and they were saying, what can we do for the homeless? And I'm like, oh, there's 3 hotels, knock yourself out.
Yeah.
So I was wondering if this is gonna be something brought up to the board to investigate or monitor or et cetera, et cetera.
Right, so we had the Mayor's Office of Immigrant Affairs join us a couple months ago. And they gave us an update on how many folks had arrived to the city. We didn't get statistics by community board because I don't think they're broken down in that way. It's something that we can, I'm sure we can ask if we know how many facilities are in Community Board 7. And if you're talking about what can be done to assist children and families, I know that there are organizations that are collecting different kinds of supplies and clothes and that kind of thing. So we can bring that information to the general public and back to this committee and to the board.
And just so you know, the city doesn't provide an exact amount of how many shelters there are in a community. There's sometimes the information is not well received, and so to protect the individuals that reside at this shelter, that information is not given out. So information on location or amount of shelters that are in a community
Public
district
money
is
is
not
being-
made
I'm
public.
not gonna argue with you, but the
Mhm.
personally, the public money is being
Yeah.
spent, the
Mhm.
public should know.
Okay.
Fair is fair.
Mhm.
My
Okay.
tax dollars are there, your tax dollars, we should know. That's
Okay,
all I'm saying.
are there any other items for next meeting? Nope. Is there a motion?
What I brought up with you about the ACS.
Yeah.
I would really love to see that on the agenda. That has been very overlooked by all community boards. And my wife's been making the rounds with the Crusaders for Children's Rights.
I'll connect with you now.
Thank you, my dear.
Motion to adjourn?
Yes.
All right. Thank you so much, everyone. Have a good night.
you.
Thank you.